Let's begin a clinical visit. A 30-year-old male John comes for doctor visit because of tingling on the medial aspect of his right hand and forearm. On examination, radial pulse is weak on right side. This young man undergoes decompression surgery. During surgery interior scalene muscle is incised. After surgery, patient present with paradoxical movement of the diaphragm. Which of the following structure is most likely to be damaged? The thoracic outlet syndrome is a syndrome that arises by the compression of the neurovascular structure by this clavicle and the first rib. So what happened in the thoracic outlet syndrome? So the brachial plexus, specifically the lower trunk of the brachial plexus that are present between the anterior scalene muscle and the middle scalene muscle. So when these structure are compressed, so what happen? It will lead to the pain and numbness on the medial aspect of the forearm and hand, and the weakness of the muscle, particularly the muscle that are supplied by the ulnar nerve. Next, the vessels, particularly subclavian artery and the subclavian vein, are compressed in the thoracic outlet syndrome. So, the weak radial pulse due to the compression of the subclavian artery and the Horner syndrome due to the compression of the cervical sympathetic trunk in the thoracic outlet syndrome. If the cervical sympathetic trunk is compressed in the thoracic outlet syndrome, it may present with the Horner syndrome sign and symptom. So, the causes of the thoracic outlet syndrome is the abnormal insertion of this scalene muscle, and the cervical rib is an extra rib that is a cartilaginous rib that compress these neurovascular structure, and the pain cause tumor. So the treatment of the thoracic outlet syndrome is the cut the extra cervical rib or the scalene muscle. So on the surface of this scalene muscle, they run a nerve, phrenic nerve. If this nerve, phrenic nerve is damaged, it will lead to the paralysis of the diaphragm. Paralysis of the diaphragm, and this diaphragm is basically the muscle of inspiration. So the on inspiration, paradoxical movement of the diaphragm take place. Normally, what happen on the inspiration, the diaphragm move downward. But in case of this, the elevation of the diaphragm take place, and it is a diagnostic on the X-ray. The elevation of diaphragm on X-ray is diagnostic for phrenic nerve injury.